Hi, I'm Dr. ERIC WESTMAN, and welcome to my channel where I review and debunk nutritional information online. This video is from SugarMD. I've reviewed some content from SugarMD before, and basically they're pushing sugar. So this will be interesting. Always consider the source. When the name of this is when protein spikes insulin, not glucose, more than a carb, a new study. Well, this is pretty interesting because it goes against what I've been taught. I've been taught that carbohydrates raise the blood sugar in the insulin.
I have been emphasizing the unexpected impact of combining protein and fat on insulin levels for some people, despite the prevailing belief that the carbs are the primary concern for everybody. Well, how do I know that? I listen to my patients. I hear their lives. Everybody's different. Many of you doubted my assertion that, keto, is great. It's going to work for everyone. Well, some people come and tell me that it's not. It actually makes things worse.
If someone learns from the internet how to do a keto diet, and they go to a doctor who's not necessarily supportive of a keto diet, like most doctors in my area, that you might say, though, it was so hard. It's, I couldn't get over not having bread or pasta or rice, or I may have had keto flu or keto adaptation, we call it, because the fatigue and headache the first few days or maybe week, actually it can be mitigated by having salt replacement if you learn from someone reputable about how to do a keto diet. But yeah, I suppose people come in and say it's not for me, even to my office. But in my experience, with the right coaching, the counseling, contextualization, helping with substitutions, most people actually do really well on a keto diet, including blood glucose regulation. And here, this doctor is trying to say that metabolically there's something wrong if someone comes in and saying, I can't do the keto diet. Well, I always ask, who taught you? Where did you learn how to do it? And a simple version means it's going to be more sustainable.
Well, this study proves my claim.
The study does not prove his claim. Actually, let me just fast forward. What the study shows is they took cadaver cells, they took dead people, pancreas, and looked at the islet cells, which produce the insulin. So we're not even talking about an intact human in this radical study that he's talking about. So they took these islet cells, put it in a petri dish or outside, it's called it in vitro, and gave it certain compounds, different types of nutritional elements in the same bath as these islet cells, and found what the insulin production was based on the different nutrients outside the body in dead people. Well, let me know what your blood sugar does in your as you're alive. And I have never had anyone come to me saying that their blood sugar goes up more after eating protein and fat than eating carbohydrates. I've never had that. Of course, the blood glucose may not go up much because the insulin goes up to keep it down. And while that's thought to be, normal, it's not optimal. And the reason for that is elevated insulin is also harmful and pro-inflammatory. So if you're having to have really high insulin levels to keep the glucose down, this is not a win, even though your continuous glucose monitor might show that your blood glucose didn't change much after eating carbohydrates. So you always want to know what the insulin level has done, but it's hard to measure insulin. There is no continuous insulin monitor. So I had to just bring in that the whole study is actually not in intact humans. It's in cadaver or dead people's cells.
Now, researchers have discovered that under certain conditions, the interaction between protein and fat indeed cause a more significant insulin spike than carbohydrates
in cadaver cells.
Now, this groundbreaking finding is poised to reshape our understanding of dietary effects and the metabolic health. Now, how many of you think that the protein and fat raise their blood sugar? Write in the comments below. I had a patient recently who said that he did everything right and then started eating carbs, that his blood sugar started going down.
Well, so that's interesting. So let's talk about that for a minute. I'm seeing some people whose blood sugars don't fully normalize, meaning get under 100 all day long, between 80 and 100 is thought to be normal. But if you're not eating carbohydrates, you're not getting much insulin to go up to keep it down. And I think over time, we're going to learn that the blood sugar is going to be a little elevated, and that's going to be okay because you don't have the high insulin levels to keep the glucose down. Now, that's not well studied, and it's a bit of an intuition that I have after following so many people for so long. But the idea is that the carbohydrate raises the blood glucose, raises the insulin. Protein does raise the blood glucose and insulin a bit, or protein can actually raise the insulin a bit on its own, which is what it's designed to do. Insulin helps protein into the cells. So even when you look at the cadaver cell model, yes, protein could raise the insulin level because insulin helps protein get in the cells. So this is now confounding the question and the issue. Insulin goes up after you eat protein, not as much as carbohydrate, but the reason is not for insulin to keep the glucose down. The reason insulin goes up after eating protein is that it facilitates the entry of amino acids into the cells. It facilitates the entry of protein into the cells. So insulin has many different roles, not just lowering the blood sugar. So that's a little, if he's not aware of that, okay, I give him a free pass. But if he is aware of that, this is a little disingenuous, that saying that, oh, look, carbs are fine because protein raises it. Well, it's for a different reason. And carbs are not fine. But it could be that if you add carbohydrates back, the insulin will go up to keep the glucose down, and the glucose can go down a little bit, which may explain what his patient noticed, that by eating carbs again, the blood glucose goes down because the insulin has gone up. Now, that's a trade-off that I don't think is a good, healthy one, but some people choose to do that, and okay, I don't know the answer, but I have seen people who add back carbs a little bit and the blood glucose goes down, probably because the insulin goes up a little bit. But is that worth it? I'm not sure.
Is he crazy? Not really. Now, of course, carbs are always getting the lion's share of attention. Everybody wants to blame the carbs, which is fine. I'm not saying go eat carbs. For some people, though, that's not necessarily true, because for some people, protein and fat can cause significant, even more insulin spike than the carbohydrate.
That hasn't been shown.
Now, this is a first large-scale comparison, by the way, for the study, for examining people to see how they respond to protein, carbs, and fats. The research team found a surprising variability in insulin responses.
In cadaver cells, so dead people, you take the pancreas tissue out and you put it in a cell. And in the paper, they talk about how immature cells, stem cells, can put out insulin in response to protein and fat. Well, remember, the protein can elicit an insulin response because it helps facilitate protein into the cells. It's not just a carbohydrate, raise the glucose, insulin gets the glucose down. There are those two things. But there isn't a side-by-side in humans. This was in cadavers and in animal, human cells, but this would be called, preclinical research. It's not in intact people.
Among different individuals. Now, glucose is a well-known driver for insulin. We already know that. But the study reveals that, some people exhibit a strong insulin response to proteins or fat instead. This really changes our belief that everybody's the same and just don't eat carbs and that's it, right?
Well, so sometimes I am a stickler sometimes I gloss over and say, okay, that's all. Call it just a carbohydrate, whether it's a sugar or a starch, whether it's glucose or whether it's fructose or, But sometimes I really just have to be a stickler. And when he says some people, he's talking about cadaver cells. He's talking about the study that was done that you'll see at the end was not in people. And yet he's talking about people. So this is a generalization that what we see in that petri dish of cadaver cells is actually what would have happened in that person when the person's alive. when actually things start to change, even in that sort of transformation and have outside of all the other hormonal inputs, that's one of the biggest confounders there, is that, this is not really studying what he's saying inside intact human with all the other things going around. It's done by a group that's trying to come up with personalized nutrition based on your individual response to these different foods, when we're still talking about cadaver cells.
So 9% responded with higher insulin to protein, and 8% responded with higher insulin to fat.
Remember, these are not people. These are cadaver cells.
This study showed that the insulin production is very dynamic and individualized.
You can go to PubMed, pubmed.gov, and put in PMID, the 9 number down below in the abstract, so 38959,864, and then that paper comes up. And so it's actually in cadaver cells, lo and behold, some people's beta cells, insulin-producing cells, pancreatic cells, secreted more insulin based on the protein and fat than the carbohydrate. Almost everyone had the kind of expected response that you would see on a CGM, and whether this is real, that 10% of people don't respond to carbohydrate, I think it's hypothesis generating. This is not hypothesis testing, and he makes the mistake of calling each one of these cadavers, the cells from a cadaver, a person, when it's not really an intact live human.
Than what we thought previously. It means that one size is not going to fit all. With a better understanding of you as a person, how your insulin is produced and how your sugars respond to different food, you can determine better. So I strongly recommend a lot of people to use those glucose monitoring devices to see how their body really reacts. And in clinics, we can actually do studies where you can check the insulin after a carbohydrate meal, protein meal, fat meal, and for those people who do not have insulin, and see their insulin response. That is very doable as well.
Carbohydrate tolerance test, or insulin tolerance test, is a tool where nobody really does it anymore in a fast-moving clinic, although some clinics do it. You have to pay extra for it, but you would have a carbohydrate meal, and you would see the blood glucose and the insulin over every hour or every half hour for a while. And it, through the years, was useful to diagnose not only early diabetes, prediabetes, but also reactive hypoglycemia. So if some people eat the carbs, the insulin goes up, and then there's an overshoot so that the blood sugar goes way down. This is usually about 2 hours after eating the carbohydrates. And this kind of insulin tolerance test, Kraft called it the Kraft test and published books on this. And so you can actually do this, but most people don't do that anymore. In my clinic, I just advise you to reduce your carbohydrate or eliminate the carbohydrate almost. You don't have to measure these sorts of things. But I suppose if you're not sure that you need to make a change, if you're really kind of hooked on carbs, I mean, if you can't give up a food for at least a few days, that's almost an addiction, isn't it? You have the ability to do whatever you want. If you're unable to give up a food or a behavior, and or a drug, that is something we call addiction. And addiction is defined as continuing to use something even though your health is going down. So if it makes you sick and you can't stop, if you're a smoker and you cough as a result of the smoking, you can't stop smoking, we call that an addiction. Is this doctor really just facilitating the use of sugar for sugar addicts to reassure them that they're not necessarily unhealthy? Yeah, probably he is, but we can measure health, and it's my job, if I'm a doctor and I'm being honest, if the carbohydrate and sugar is a problem for you, I'll tell you. That's my job.
The protein-rich diets actually can help, because if you think about it, if you are making more insulin when you eat high protein and you're diabetic, meaning that your insulin production is not good enough. Yes, you're insulin resistant, but you're also having some deficiency of insulin at the same time. If you incorporate a lot of protein in your diet, that can force your body to make insulin for some people, and that can actually be a tremendous help.
Yeah, so I don't think that's the right way to look at it. And I think I don't even think that's really correct. So you're not going to be making more insulin because you're eating protein. If you drop the carbs down, the insulin resistance gets better. The insulin that you have is more effective. And so actually carbohydrate can cause insulin resistance. And reducing the carbohydrate reduces the insulin resistance. That's a very interesting twist that I hadn't heard before, which I don't think is accurate, meaning a low-carb diet raises the insulin level and improves glucose because you're eating the protein that raises the insulin that lowers the glucose. No, it's because you're not eating the glucose.
Now, traditional carb counting may not be great for those people who respond with more insulin to protein and fat. Then you have to think a little bit differently. Now, I've been telling my patients also, especially type 1s, they sometimes concentrate on too much protein, but they don't make any insulin. Well, that protein can actually increase your glucose, albeit more slowly. That's why your body has insulin response to protein as well. But it's much less, 5 times less likely to increase the blood sugar levels.
Then what? The protein raises the blood sugar less than carbohydrates. So funny, you just couldn't say it.
Or think about it, you're type 2 and you're eating protein and you have the ability to make the insulin. Now the carbohydrates you eat will be taken care of by the proteins you eat because the protein is stimulating the insulin. So I think that's partly because of the GLP-1 hormones that are stimulated in our intestinal system when we eat proteins, and that some people are very much responsive. And that can also explain how some people will respond to medications like Ozempic and Mounjaro, and some will not respond. So I think, it's so interesting how people are different. As a practitioner, as a physician, I enjoy treating patients, working with them, seeing their happiness after things work out.
Sugar MD pushes sugar, or is an apologist, is one who sticks up for sugar, for I don't know why necessarily, but you can actually measure this in yourself using a continuous glucose monitor. You can measure your blood pressure on your own using a blood pressure monitor. These are all very useful tools when we deprescribe the medications, when we use low-carb and keto diets that don't have much sugar and carbohydrate in them.